Hi, everyone, and welcome to our mental health educational presentation. My name is Missy. We are so happy you're here. I'm joined with my fellow classmates, Alyssa, Anna, and Ellie. Um, we are fifth semester nursing students at Azusa Pacific University. During this semester, we have been taking classes in both mental health and population and community health. And during our studies, we've had to do various assignments that we've had to go out into the community and interact and interview and investigate and do a lot of research to see who some of our most vulnerable populations are in our community, what their needs are, and how we can help them. So during our research, we found that our greatest needs, specifically where we were, our target location was in Riverside, California. We found that mental health was a big concern for a lot of people. So that's what we focused on, which actually worked out with our studies that we're currently doing. And we want to have this presentation be as a tool, as an aid to anyone that is thinking they might have a mental illness or know someone who does, and just get more information, kind of a starting ground for people, where to start. We know how daunting and intimidating it can feel, and we just are so proud of everyone who is joining us right now and wanting to start that journey. So it's very exciting. Some of the things we will be covering is like things like, what is an ACE score? What are available treatment options for mental health? Creating action plans and coping strategies, that's a big one. And then how does childhood trauma repercussions affect us in today's life of everyone? So just things like that we really want to go over. One of the things we're first going to do is just go over some of our personal experiences we're going to share. So our first person that will be sharing is Anna.
Okay, so I'm actually going to be sharing in the PowerPoint now. That was just a little intro. Thank you, Missy. Okay. Okay, so hello everybody. My name is Anna, and I know a lot of what we are going through is very hard, especially during the times of COVID and how the pandemic has affected and impacted all of us. And how we are doing now is probably, way different from when the pandemic first started. But I do want to say it's not easy taking that first step to get help for mental health. But if you are here, we are all four of us are very proud of you. And I wanted to share a little story of when I was dealing with depression and anxiety in some of my adolescent years. To start, this is a more very personal story, but I was 16 years old and I was in an abusive relationship. And I was deeply struggling with self-esteem issues as well as setting boundaries. And on top of this, I also had problems at the house. The more and more I stayed in this relationship, I thought about, unfortunately, taking my life. And I think shortly after that, getting help started there. After being 5150, I had made the promise to not only my family, but to myself to seek help. I began seeing a family therapist who helped me identify the deep-rooted issues I was having trouble with confronting, and I started on antidepressants shortly after. I finally was able to get out of that toxic relationship and started my journey with mental health. 8 years later, I am now in the nursing program in my hometown with the goal to be a psychiatric nurse.
And then I'll just share for me as well. Again, my name is Missy. I'm 38 right now. My personal experience is a little bit different than Anna's, but it's still, I know it can reach people. I personally did struggled in the past with some depression and anxiety, and growing up in a family with, I would say, severe mental illnesses contributed to that greatly. Just to share a little bit of background, I grew up in a family where both of my parents came from very abusive and traumatizing homes, and that transferred over into their adult lives and into our family, the dynamics and everything with my siblings and I. So growing up in a home where mental and emotional issues were on the rise, it was not dealt with head on and created a lot of friction and conflict growing up. That led to, even recently, I'll just say, some of my family members, one in particular has tried to commit suicide at least twice, and another one has been threatening to harm other members of the family. So it's been really, really severe. When I discovered that I was having depression and anxiety issues, I decided to deal with it. At first, I thought when I became an adult that I would just move out and everything would be okay. Well, that didn't solve everything, unfortunately. So then what I did was I sought help online. I found some resources. I got serious with my faith with God, and I started to see progress. I started to see healing in my thoughts, my feelings, my actions, and that was huge. I'm very grateful, and I just can only wish that I started sooner. And as far as my family, they have started as well seeking professional help and having regular therapy sessions, which has been very helpful. I've already seen a difference in them, and I'm excited to see what the future holds for us. So that's my story.
Okay, so to kind of go into the statistics a little bit, as we did talk about, the presentation is mainly focused in the Riverside location. However, we will kind of go into a variety of different umbrellas as far as like where to get help, you know, if you're not obviously in the Riverside area, if you're outside of California, and, you know, if you're somebody online just trying to seek more like anonymous help. But I kind of wanted to get into the statistics of mental health and the reason why we are going into mental health. So if you, like I said, if you're not in California, we will get into that a little bit later, and we will be giving other types of resources. But the purpose of teaching on mental health is extremely important due to the fact that in the state of California alone, from the Riverside County to the Los Angeles County, there's 300 to 1,000 deaths each year that are, you know, obviously suicide related. And then to further elaborate on that, 46.1% of individuals in the state of California struggle with depression and anxiety. This means 4 to 5 out of 10 people do struggle with that. And, you know, it's very unfortunate, which is almost half of the population in California. And to step away from California and assess mental health in the online communities and forums, most of what we observed in the online communities were people talking about their struggles in the groups that I have obviously found you guys in today. And this is important to assess as sometimes the supervision of online communities is very hard, you know, to kind of look at, you know, it's especially on the platform of Facebook, it can cause others to be triggered, which is very important to assess and like obviously address it. And worse, you know, especially in these kinds of groups, you never know the intentions of others. I have even seen others encouraging others to hurt themselves. And, you know, just to kind of look on the right, we have statistics of the top 10 countries in the world who struggle with depression and anxiety. So the top 10 countries with the highest rates of depression are Ukraine, United States, Estonia, Australia, Brazil, Greece, Portugal, and Belarus. And which, you know, and then under that, the younger adults are more likely to report symptoms of anxiety and or depressive disorder during the COVID-19 pandemic. The ages 18 to 24 were 56.2% more likely than the rest of the age groups to report that they were struggling. But, you know, regardless of the statistics, it is always important to check in on loved ones, neighbors, and family members, friends who may be of that age group, more unlikely to reach out for help as, you know, they start to get older, they're more unlikely to be reached out to because of their age. And then the next slide, we're going to present Elizabeth.
Hi everyone, I'm Elizabeth. So Starting with our purpose and our goal with this presentation. So by the end of the presentation, we want you all to be more knowledgeable on strategies to better cope with the negative feelings that may present by developing positive behaviors and decision-making for mental health issues, as well as adopt prevention strategies to prevent possible future mental health crises. In addition, we want you all to understand how possible childhood traumas may have contributed to your mental illness, and this will be done through the teachings of ACE course. Okay, so key objectives. So these specific objectives are aimed in creating a better mental health state for the audience. So we will educate you all and those that are suffering from mental health issues on the variety of topics that are crucial in comprehending what you may be going through. Some of these areas will include what are mental illnesses, environmental and social stressors that may lead to mental illnesses, the different presentations of mental illnesses and ACE scores, what they are, how they are calculated, and how their scores may have contributed to the mental health issues you are now facing, as well as additional support groups for mental illnesses. Specific objectives within this presentation that we want you all to reach, as we want you all to be knowledgeable on the 3 different signs and symptoms attributed to and present in specific mental illnesses. We want you all to be in a position to verbalize 2 resources that we have provided through the presentation where you can seek help. And we want you all to accordingly state appropriate times where you may be able to seek help from the previous resources provided, as well as the differences and help you can achieve from the different resources. We also want you to understand and name 2 of the different adaptive coping strategies in response to stress, anxiety, and depression. And lastly, we want you to be able to describe the purpose of the ACE scoring system and verbalize the meaning of these specific scores in relation to possible side effects of mental illnesses. So this is a pretest. You can just take out a piece of paper and jot it down, and then it's more of like a self-reflection tool for yourself. So this pretest is conducted to measure your general understanding on topics of mental health. There is no right or wrong answer. So the first question that you can ask yourself is, can you name the different mental illnesses you know of? Is there any mental illnesses present in your family that you are aware of? And then the next one is, what are environmental and or social stressors that can lead or trigger a mental illness? Third question is, are you able to distinguish the different signs and symptoms in stress, anxiety, and depression? If so, what are they? Fourth question is, can you name 1 coping strategy you may use when you are feeling down and as if your mental illness is affecting your personal and social life? And the last question is the Facebook community support group the only resource you have available? Can you state any resources that are readily available to you, which may act as an outlet for you in terms of your mental health? Okay. So next, what is ACE scoring? So the ACE scoring tool is a tool which helps measure how possible life adversities may have caused a trigger in an individual's mental health issue later on in life. A tally of these different areas help create a score out of 10. So the bigger the childhood triggers one may have had and been exposed to, then the higher scores they will receive through the ACE scoring system. It's important to keep in mind that this tool should be only used as a guidance. If the ACE score is 1 to 3 without the patient is at intermittent risk for toxic stress. If the ACE score is if the ACE score is 4 or higher, the patient is at high risk for toxic stress. So these are the ACE screening tool questions that you can use. So like I said, you can get a piece of paper out and jot down. So each check mark to a box of these is a tally mark, and remember, it's out of 10. So the first question is, did you feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect or take care of you? Did you lose a parent through divorce, abandonment, death, or other reason? Did you live with anyone who was depressed, mentally ill, or attempted suicide? Did you live with anyone who had a problem with drinking or using drugs, including prescription drugs? Did your parents or adults in your home ever hit, punch, beat, or threaten to harm each other? Did you live with anyone who went to jail or prison? Did a parent or adult in your home ever swear at you, insult you, or put you down? Did a parent or adult in your home ever hit, beat, kick, or physically hurt you in any way? Did you feel that no one in your family loved you or thought you were special? Did you experience unwanted sexual contact, such as fondling or anal, vaginal intercourse penetration?
Okay. Hi, my name is Alyssa, and I'm going to be discussing how to recognize mental illnesses. It is significant to seek help when recognizing your emotional, psychological, and social well-being. Mental health is an essential to your everyday life, and it can also affect your physical health. It can affect your emotions, thoughts, and behaviors. Signs and symptoms that you may be feeling are feelings of worthlessness and guilt, decreased energy, changes in sleep pattern, extreme mood changes, diminished concentration, diminished interest in activities or seeing friends, changes in eating habits, suicidal thoughts. Prevention methods could be pay attention to your warning signs, get routine medical care, relaxation strategies to cope with stress and anxiety, increase physical activity, and express to someone you trust of your worries or difficulties that you may be facing. Okay. Also, here are valuable resources and support groups that are here for you. Also know that it is okay to seek for help. Available resources are there's the National Suicide Prevention Lifeline, there's the Crisis Text Line, and also in Riverside County, there's available resources to contact to seek for help.
Okay, so the next thing we're going to be going into are the community partners that are influential for mental health, include the Riverside University Behavioral Health System, specifically Arlington. Again, these are just more specific to California alone, but later we're going to be talking about different ways to get help if you're not specifically in Riverside. So the community partners that are going to be influential are in San Bernardino and the Riverside counties. The reason as to why specifically Arlington Hospital is influential is because they offer a variety of services, including a crisis intervention team, psychiatric emergency walk-ins, rehabilitation services, suicide prevention services, primary care services, and drug recovery services. As far as the different approaches to therapy, they provide cognitive behavioral therapy and activity therapy to help patients be more involved with others and help develop social skills for when they become discharged and they're out there. Maybe they don't have family to go with, but it's important for them to get into that step of having to be independent once again. The reason as to why this community partner is perfect to include for this teaching of mental health, if you are in California, is because they accept individuals of all ages, such as children, adolescents, adults, and even seniors. They accept Medicare, Medicaid, and TRICARE, and even Medi-Cal in some cases, and they have a variety of units, counselors, therapists, nurses, and are very professional when it comes to talking with the patients. They establish goals, make it reasonable for the patients to reach their goals with mutual needs, implementation of their spiritual beliefs, and will make goals based on the signs and symptoms they observe from their patients. And then just to kind of go into other options for those who do not live in California, these are important community partners as well, and they're very influential to mental health in the delivery of community mental health, as many patients do get referrals and can pay out of pocket for these as little as $30 a month in their first month, and then they start to increase the price. However, if you do have insurance, they do cover most insurances. So the good thing about these telehealth services is that the patients can get same-day appointments from the first time they decided to join, and even with the first day appointments, they're able to pick up their medications or, even have like a full 1-hour therapy sessions within that day if they, if it's see fit So the benefits of BetterHelp, to discuss the first one, is that it is provided by a licensed therapist, and you can message your therapist at any time. So you can reach out anytime, schedule calls to your convenience, and you can schedule appointments stress-free. And they also offer group support. And if you're uncomfortable or unsatisfied with your provider or your therapist, they will offer you the choice to switch therapists without any questions asked, and without any additional charge as well. And then when we go into the next app, which is Cerebral, it is an app that allows patients to get mental health medications easier. When patients join, they do the ACEs score and an individualized detailed assessment to assess the score of either anxiety, depression, or stress. These were advertised mainly on the platforms because during the times of COVID, it has become increasingly difficult to get mental health services for those who really did need it. These are influential not only because it is a way to provide faster mental health care, but telehealth became one of the most popular methods to get help during the pandemic. And again, upon joining, these apps will automatically have you fill out a form, and it'll start asking you questions about your mood, your current mood, your sleep, eating patterns, if you have any religious preferences, whether you hear voices or not, if you have feelings of hurting yourself. And once this whole form is filled out, the prescriber will see you right away, and then you can have the medications delivered to your local pharmacy, or you can also have them delivered right to your home. It's just up to you, and whatever makes you comfortable. And then as we go into the different types of therapies, we're going to recommend the first one, which is CBT. And the reason as to why it is important to provide for patients the CBT therapy is because it helps with thoughts, emotions, and behaviors. The point of cognitive behavioral therapy is to change one's perceptions on things and helps patients slow down their thinking to change it to a more different perspective that's beneficial for them. The next type of therapy is motivational enhancement therapy. And this therapy is more of the issue with obviously substance abuse. And it just kind of helps remind the patient that they have a good support system, and if they want to, they are able to, and they have the support to stop using substances. And then the very last one is the dialectal behavior therapy, which is a method that may be used for those with more extreme circumstances and riskier behaviors. The point of this therapy is to help the patient relax more and begin to improve the stressful situation. It also helps with weighing out the pros and cons of the person's behavior and addressing coping mechanisms, such as distracting yourself, or help soothe the patient's stress.
Okay, so coping strategies. These are always good. Some of the things you can do is staying active. You always hear how people say how exercise benefits you in so many different ways. Well, it does even mentally and emotionally as well. So staying active, things is like jogging, walking, swimming, doing yoga, hiking, dancing, things like that is very beneficial. Another thing is just staying connected. So many times, and I know I'm guilty of this too, when you're not feeling your best, you tend to isolate. You tend to draw away from others. Please don't, or at least when you recognize that you're doing that, please do something about it, such as talking with your loved ones and friends. You can write a letter or email, spending time with pets and animals. I have two. That always helps. Or even joining a support group or a special interest group is beneficial as well. Another thing is just staying healthy. Number one thing is getting quality, sufficient sleep. That is a big one. When we don't get enough sleep, again, it affects so many things that we're not even really aware of, that it is all intertwined with. So getting enough sleep, quality sleep, is so important. Another thing is eating a balanced, healthy diet. Next is being mindful. This really does work. Taking deep breaths, meditating, prayer, journaling, drawing, or painting, something like that is just so helpful, just de-stressing and focusing in on the moment. It's very beneficial. Then the last one is taking time to relax. We live such busy lives, but we need to carve out some time for ourselves. And there's just different suggestions here that I put down, such as like aromatherapy, crocheting, knitting if you're into that, listening to music or playing music if you play a musical instrument, reading a good book, or just going into nature, just taking a hike somewhere and just getting away from it all. It really does do some good for you.
Okay, so next we want to see if you guys have been able to gain some knowledge from what we have presented so far. So you can just pause the presentation if you're watching it on Facebook. So I'm just going to kind of go over. So for anxiety disorder, so the correct answer is A. So for anxiety disorders, it's classified when you respond to certain objects or situations with fear and dread, as well as with physical signs of anxiety or panic, such as rapid heartbeat and sweating. And then for PTSD, the correct answer is C. So this is conditions that can develop following a traumatic and or terrifying event, such as sexual or physical assault, the unexpected death of a loved one, or a natural disaster. And lastly, mood disorder, the correct answer is B. So this is a persistent feeling of sadness or periods of feelings overly happy, or fluctuations from extreme happiness to extreme sadness.
Okay, post-test questions. So the post-test is conducted to reflect and identify your overall progress and understanding of mental health after asking various questions from the pre-test. As stated above, there is no right or wrong answer. Starting with the first question, were you able to identify the different types of mental illnesses throughout the presentation? Are you able to identify any of these mental illnesses within your family? The second question, did you identify any environmental and or social stressors that show or trigger a mental illness throughout the presentation? Third question, were you able to differentiate the signs and symptoms that contribute to stress, anxiety, and depression after the presentation? The fourth question, during the presentation, did you think of a coping strategy to use when you are feeling down, or when your mental illness is affecting your personal or social life? And then the last question, were you able to recognize and access readily available resources when needed to help with your mental health?
So in closing, I would just like to thank you all, from myself, Ellie, Anna, and Alyssa. We appreciate you guys being here and taking the time and just investing in yourself. This is the first step, and we're so excited for you. As nursing students at Azusa Pacific University, we are so excited as future nurses to help everyone. And this is just one way that as students, we can reach out to our community and just be a part of the change. So we're very excited about that. We hope that you now have a better understanding at some of the symptoms that are associated with mental illness, why it's important to treat it, what treatments are available to you if you're local in the Riverside County, or even just nationwide, some of the resources that were mentioned earlier, how to get started, who to reach out to. All of that is super important. So we just thank you so much. We do have a handout for you guys. This is from Alyssa. She found this, and so kudos to Alyssa. Thank you so much. This is just what we talked about earlier about like a self-care plan, and it's just different things that you can kind of have this. You can take a screenshot of it or whatnot with your phone, but just different things to be aware of, and like, am I applying this to my life day to day? So this is a helpful tool for you. And then I think we're moving on to Elizabeth.
Hi, everybody. Again, it's me. So we have created a Google Doc where we're kind of just asking questions in regards to how our presentation went and if you were able to gain any valuable knowledge. We're going to include this link on the bottom of this video, wherever it is. And just know that these responses are completely anonymous. It's just an input for us so we can see how well we did and what we can improve on for next time. But yeah, that's all our presentation. Thank you all for tuning in. I hope we were able to help in a way.
Thank you.